So topic is wrist ganglion. Wrist ganglion. So dear students, we'll discuss a common clinical case that is swelling on the dorsal of the wrist. Just find out what exactly it is. See that? See that dorsum of the wrist. There is a very well localized swelling, maybe around 2 centimeters in size, spherical in shape, and always you have to check against resistance. There is a swelling here, extension against extension, like that you have to do extension and see the mobility. Initially check the mobility with the relaxed wrist, both in two direction. Mobility always should be checked in two direction perpendicular to each other, not one direction, remember, because muscle moves horizontally always. So two direction you have to direct tuck, like this, like this. If some swellings in the wrist, back when the dorsum of the wrist or front of the wrist, when against resistance in dorsum against resistance in extension, in the plantar aspect, in the ventral aspect, it is there flexion. So against resistance, when you do like this and mobility will be restricted, that means it is a swelling. And also you will check the fluctuation. You see what is called as the Page's test of fluctuation. Fix the swelling, then over the summit, press your finger, indent your finger, then you will get yielding sensation and fluid movement. Your finger get yielded, fluid movement you will get. That is called Page's test of fluctuation. So to do that, you check the mobility, and if mobility is restricted one or during wrist extension against resistance, and if the Page's test is positive, then most probably diagnosis is ganglion. Ganglion is very common entity, especially in young individual, can be bilateral. Small ganglion may subside on its own. Olden days they used to put Bible thick book over that and press it so that rupture it. Then check the again same thing like any swelling examination which is there in my clinical methods in surgery in detail with the video of examining the swelling. You can go through my clinical methods and have the idea about how to examine a swelling. Same methods: temperature, tenderness, skin pinchability, mobility, location, size, shape, surface, consistency, against resistance, whether it is against resistance the deeper muscle as such, and mobility restricted or not, plane of the swelling. And axillary lymph node should be examined, opposite side should be examined. So detailed examination, transvalination, Page's test, opposite side, opposite wrist, everything I have written here. So detailed examination as per my clinical method in surgery, swelling chapter you should do. It's a clinical short case, always remember. It is a short case. And oxy may be kept also. So DDs are neurofibroma, lipoma, lymphocyte, but very typical ganglion it is, wrist ganglion. But these are the differentials you have to keep. If it is very translucent, highly mobile freely, even after wrist extension against resistance, then it is lymphocyst like that. And so read my manual of surgery in detail about ganglion, a common short note, common clinical case, oxy will be kept, YO will be there, MCQ can be asked, and I am not going to detail it. It is there in my book. The cystic swelling occurring in the tendon sheath on the dorsal aspect or ventral aspect or around the ankle. Common in the dorsum, next common is ventral aspect. Third common is around the ankle, maybe bilateral. So important thing is it may be leak, contains synovial gel-like fluid, very thick gel-like fluid. So it may be attached to the tendon sheath, synovial sheath. So entire treatment is under local anesthesia. Often can use a tourniquet, and entire cyst capsule has to be removed along with the sheath which is protruding. If it is connected to the joint capsule should be sutured. Otherwise recurrence can occur. That's why there is a very important entire thing to remove. That sheath which is coming out also should be removed, and the capsule of the, if it is from the capsule of the joint, then the capsule of the joint also should be removed after proper excision. So that's important thing. Under local you can do that. So to avoid recurrence, proper technical surgical management, surgical skill technique is very important in ganglion. So very common short case kept, a common theory question asked in the exam. Remember ganglion. And students, so for that read my manual of surgery and clinical method in surgery. You will learn everything about swellings, and one of them is ganglion. So again, I request students to subscribe my YouTube channel, press the bell and share with your colleagues and friends, and also for detailed understanding of daily small brief lectures on clinical cases of different types, newer type, X-rays, images, instruments, specimens, brief operative procedures, and different incisions. And also join live sessions once in 2 weeks with 1.5 hours interaction with the clinical case with the different senior professors. Also will get, if you join live session, certificate which will be very useful for your in future career as such. And also request you to go through my manual of surgery and clinical methods in surgery. So answer the MCQ, students, please. I will appreciate your answer and acknowledge. The clergyman's knee is A, B, C, D. Put the right answer in the comment box. I'll appreciate. And lymphangioma circumscripta is a type of cavernous hemangioma, capillary lymphangioma, cavernous lymphangioma, capillary lymphangioma, lymphangovenous malformation, cystic carcinoma. Put the right answer. I will appreciate your answer. And students, quotation of the day is: don't ask permission to fly. The wings are yours. The sky belongs to no one. So when you are capable, work on your own. Don't depend on anybody. Don't shy of that. Everything is yours. You can always explore, but in a specified preview of the ethical view, that's important. So that is the quotation, especially for surgeon. Again, request students to subscribe my YouTube channel and share with your friends and colleagues. So students, I hope you have understood this lecture very well. Thank you so much.